Hi, welcome to this section of cardiology. This is Dr. Jaitly. In this video, brief vignette, I'll be talking to you very basically about what are varicose veins and should you be concerned if at all they exist. Well, varicose veins are, let's look at on the left panel here. Varicose veins are, they start with very small spider veins over the legs. Normally it's always in the most dependent portion of your body, but they can occur anywhere in your arms, in your facial regions, or in your chest or back, etc. But the fact is that they're mostly located in the legs. So they start with small spider veins. I'm sure you've seen them occasionally on somebody's face, or maybe on the arms, or even on the feet, etc. But then they start to grow and become more swollen and tortuous. You see how tortuous they get. And then they get swollen and tortuous. They turn a little more blue because of the stagnant blood. Now, invariably, it's all related to either, as we get older, it's related to your age. Pregnancy is certainly a factor, so obviously women are more prone than men, because post-pregnancy, there tends to be a little more stagnation of blood, which persists for a longer period of time, either because of the swelling or the gravid uterus, which is now delivered and now is returning back to normal size, and during the pregnancy there is compression of the veins, etc. So a lot of these what you call the valves within the veins, they get either weakened or they're congenitally weak to begin with. Sometimes there are even absence of venous valves in some individuals, so they're very prone. And then prolonged standing will do it. If people like, say, military recruits, policemen, they're constantly standing, or nurses, doctors, they always stand a lot in their work. So, or research or lab personnel, they're constantly standing by one area. Teachers. So these are some professions where a lot of standing is required during the course of the day. So that would certainly make it a little more prone for risk. Now, symptoms normally, they may be mostly cosmetic to begin with, especially when they are in the spider vein size, and they look like spider webs, small little tiny webs, and they may be either blue or purple, but they may require just cosmetic removals. If there are one or two, you could do them. But as the segments get more involved and for larger extent or longer extents, that's where the continuous ache begins, and then it starts to hurt. And when it starts to hurt, then obviously the pain is mostly on standing or soon after walking. And sometimes it's unbearable even at night when the person is wanting to sleep and rest. So then again, he or she gets up and starts walking, and that's the last thing you want to do. You want to really keep your feet up and against gravity and on a pillow or something, so this way it's relieved. So it's like self-care, but it has to be advised to the patient properly, and therefore persons can actually get better, at least in the initial stages. Now, itching is commonly occurring because of the oozing of the blood sometimes occurring, and therefore there are some discolorations within the skin, and initially greenish yellow coloring, and then finally even blue and red can appear under the skin, and that shows that there's a lot of chronic venous stasis changes that develop under the skin. Very rarely one would see a cellulitis, especially only in diabetic settings where or poor hygienic conditions in the legs. And venous ulcer is prevalent also in diabetes patients because they chronically not heal, and that's one issue where with diabetes the healing is always delayed, so they have to be taken very seriously. And then the venous ulcers, they sometimes get infected, and that could be a source of infection that could spread and cause more thrombophlebitis, mostly superficial though, but still is very painful and requires intravenous antibiotics, etc. So there are numerous places where it can get problematic, just so that you know, especially the venous ulcers. And not to forget the bleeding. The bleeding normally occurs from the venous ulcers or even from the veins that can rupture after being tortuous and swollen for a long period of time. They may get more fragile under the skin. Sometimes the bleeding is just under the skin, so it results into a hematoma subcutaneously or cutaneously, but many times it just overtly bleeds, and therefore it requires immediate hemostasis. So bleeding is normally very small. It's self-contained mostly, but sometimes it could be it could be prolonged. But in any case, obviously, bleeding from any side is always very concerning. Now, treatment is based on what you want to do in the initial stages. As I said, for spider webs, one can have them resected, or laser therapy can be offered to them. There are one or two. Self-care, obviously, elevation, and then putting, try to rest in between your work stages. That helps a great deal. Compression stockings are wonderful because they constantly compress as the person walks, and they become like peripheral pumps, and therefore they ease in sending blood back to the heart. So the venous blood is not stagnant, and the venous veins and the valves, they are aided with these compression stockings. They will also prevent the swelling from occurring in the ankles and distally. Sclerotherapy and foam injections, they have been around there for a long time, and a solution is injected. It can be done at a doctor's office. It's a fairly superficial and a very minor procedure, and the vein, say if this segment is involved, then automatically it could be sclerosed, and in a few days this portion of the vein can just fade away, and no more venous congestion or swelling or tortuosity will be seen. So it just gets decompressed automatically by sclerotherapy, because it just shuts off that area of the venous circulation. And there's nothing to worry about, because there's plenty of veins from within, especially the deep veins, like I've shown you here in the right panel. The deep veins will take over, and they'll have their own tributaries, etc., and the venous circulation is always maintained, so it's not an issue at all, even after a small segment of sclerotherapy that's offered here. Laser therapy is wonderful because that's painless, and it's also done in an office setting, and there are no scars, obviously, and it just again works at a similar principle, where that portion of the vein is obliterated and then finally fades away. Venous stripping has been around for a long time, but that's an invasive procedure where a portion of the vein is tied up, and the smaller veins distal to it could be pulled, and so as a result, the varicosities can be treated or minimized to the extent. But this is obviously an invasive procedure. It may require hospitalization for overnight, etc. So just to monitor the patient. That's about the varicose veins. I thank you for your attention, and let's move on. And I hope you found this area also interesting. And we'll have more intricacies as we discuss further on my video presentations. Thank you. Goodbye.